Okay, everyone. So for the sake of time, we are going to get started, and then people will continue to roll in, I imagine. But hello to everyone who is on the call so far. Thank you for joining the webinar. My name is Veronica Karp, and I am the program coordinator of the Love Your Life program at Iris House. So before we begin, I'm going to give you a kind of brief overview of what we're going to be expecting over the next hour and a half. So first, we are going to have this little welcome and introduction, and then I'm going to explain how to use the chat for those of you who are currently on the computer using Zoom. Then we are going to have a brief introduction to Iris House, as well as our Love Your Life program, which is sponsoring this webinar. We are going to have a presentation from Vanessa Johnson about emotional intelligence, a presentation from Giovanna about trauma-informed facilitation, and then a final presentation about managing strong emotions in groups by Theresa Allen. And then we will have a little discussion, Q&A, and a wrap-up and conclusion. So I also wanted to establish the learning objectives and the kind of purpose of this webinar today. So the first objective is to define emotional intelligence and discuss the role it plays in facilitating support groups for people living with HIV/AIDS. The second is to learn how to integrate trauma-informed care practices into support group facilitation. And then the final objective of the day is to discuss practical tips for managing strong emotions and personalities in support group settings, which is something that I imagine we've all come across in our time managing support groups. So before I get into Iris House, I want to quickly give everyone a sense of the controls. If you are currently on the computer using the Zoom program, there are a lot of different things that you can do on here. So if you look at the bottom of your screen and kind of move your mouse along that bottom part, there are a few buttons that you can press that will be useful for us today. So I will note that if you were just calling in on the phone and you are not using your computer, we won't be able to hear you talk. Everyone's automatically muted. But if you wanted to get in on the conversation and potentially use the chat, then you would just have to log in on your computer as well. So one of the first buttons that we will be using today is the chat button. So if you click on that, a little chat box will appear. And in there, you can type to the individuals who are giving the presentation, and you can also type to other attendees. So you can see it kind of just looks like a typical Skype or instant message chat box. And there is an option to select who you are typing to. So I believe the automatic selection might be all panelists, and if it is, you can change it to all panelists and attendees, and then everyone who is presenting on today's webinar will be able to see you, as well as the other people who are listening. So I see we already have Sonia and Sandra typing in the chat box, which is fantastic, so glad to see that it's working. The other button that we are going to be utilizing today is the Q&A button. And if you select that, it will give you an option to ask a question that we will then be answering throughout today's workshop. We're going to try to make this as interactive as possible and give you the opportunity to ask the panelists questions about their presentations. Also, please note that today's webinar is being recorded, so please don't disclose any information or share anything that you would not want to, have on the recording. A few other kind of housekeeping ground rules I want to quickly go over is to try to keep comments succinct and on topic so that we're respecting everybody's time. Again, like I said, don't disclose any personal information since this is being recorded. Ask for clarification and explanation if you need to. Again, that is why we have these Q&As in the chat box available. And then finally, be respectful and supportive of others. Pretty standard ground rule. So if you are having any difficulty with anything in Zoom, again, if you just type in the chat box to the panelists and attendees or ask a question in the Q&A, then we should be able to address that for you. So now that we've gone over the Zoom kind of technical side of things, I wanted to quickly give you all a little background on Iris House in case you are not familiar. So Iris House is a nonprofit organization that is located in Harlem in New York City, and we provide comprehensive preventative, educational, and supportive services to women, families, and other underserved populations that are impacted by HIV/AIDS and other health disparities. So at Iris House, I oversee and coordinate the Love Your Life project, and I want to give you a little background on that because it's directly relevant to what we're going to be talking about during today's presentation. So back in September of 2017, Iris House was named a grantee for ViV Healthcare's Positive Action for Women initiative. And the Positive Action for Women initiative is one of ViV's community-based programs. And the purpose of it is to promote community collaborations that break down isolation and stigma, specifically for cisgender and transgender women of color living with HIV. So for our Positive Action for Women project, we launched the Love Your Life project. And the goal of Love Your Life was to create national virtual support groups that would engage isolated cis and transgender women of color living with HIV in care and increase their rates of viral load suppression. So we've been working on this project for over a year now, and in that time we have launched 2 national virtual support groups, one in English and one is in Spanish. The groups are each held once a month using the Zoom platform that we're all currently using right now, and we have participants calling in or accessing it via their phones and webcams from all across the country. I think we have currently 11 states represented, which is really fantastic, so a lot of women have different experiences. And we have 2 facilitators for each group. And so they select a different topic every month, and the women come on and discuss it. Some of the things we've talked about thus far include stigma, family, self-care, the Me Too movement, things like that. And so we've learned a lot of lessons from these virtual support groups, and some of them we are going to be discussing today. And we actually have one of the facilitators of our English-speaking virtual support group, Theresa Allen, on the call to give a presentation. So if you have any questions for her about the specifics of running a virtual group and how that differs from running an on-site group, you can definitely feel free to ask her about that. So these are the flyers. If you're on your computer, you can see for both of the virtual support groups, the Love Your Life and the Ama Tu Vida. So if you know of any women who might be interested in getting involved in the groups, or you have any questions about them, I'm going to give you my email and contact information at the end of the presentation, and you can always feel free to get in touch with me. All right, so now I'm going to be introducing our first speaker, Vanessa Johnson. So Vanessa is an expert facilitator and trainer with earned certifications to conduct several public health HIV interventions. She has extensive experience and expertise in public health with an emphasis on health disparities and social determinants of health through the lens of equality and equity. And that led her to co-found Ribbon Consulting Group, LLC. Vanessa is a graduate of Temple University School of Law. So Vanessa, I will turn it over to you.
Thanks, Veronica, and welcome everyone to this webinar on emotional intelligence and support group facilitation. That's my portion of the webinar that I will be speaking and addressing today. I am very proud to be part of Iris House's Love Your Life project and involved with the different partners that are a part of this project. So the importance of emotional intelligence. We're going to talk about 3 things: self-care and health, relationships and professional performance. And then we'll talk about some attributes of emotional intelligence, and I'll end the presentation with some tips on how to keep the group pretty emotionally even in the face of intense emotions or upsetness in the group. And it could be overjoyed too. Sometimes folks get into laughing gigs and you have to help them get back to where they were. So let's talk about being healthy. That's the ability to manage stress, which helps people to be healthy, both physically and mentally. Yeah, you're right on the right slide. Thank you. And this all has to do with how you manage stress. And being able to manage stress really involves your ability to understand and manage emotions, as well as knowing when you're in a mood swing or when you have the inability to form strong relationships, which can sometimes make you feel lonely and isolated. And that leads into being in relationships and understanding and ability to manage and control of emotions make people able to express the feelings and to understand how others feel. So when you can manage and control your own emotions, you're able to be more present with people that you're around. Then the third is being able to perform professionally. And this helps people overcome the social complexities of the workplace. And I guess that all of us have our own stories and we could tell about how things have been managed in terms of our own workplace. It can determine leadership capabilities, your ability to help lead and motivate others, And I will say that in terms of job offerings and job searches, that this is one of the components that interviewers are looking for. Next slide. So now we're going to talk about what is emotional intelligence. And there's 4 key words here that are underlined. Your ability to recognize, understand, realize, and manage emotions. So emotional intelligence is the ability to recognize your emotions, understand what they're telling you, and realize how your emotions affect people around you. Emotional intelligence also involves your perceptions of others. When you understand how they feel, this allows you to manage these relationships more effectively. Let's go to the next slide. And so there are 2 components I'm going to talk about in terms of emotional intelligence. This is not my work at all. It was developed by the Hay Group in their emotional competency inventory. So if you're interested in that, I can put that information in the chat. But here we're going to talk about personal competence. On the next slide, we will talk about social competence. Personal competence consists of awareness, response, manage, positively direct. And I'm going to only cover probably self-awareness and self-management, and I'll say a little bit about respond. So in terms of self-awareness, this is how aware you are and how you accurately can assess your emotions. Most of us are so busy with the daily grind that we rarely take a step back and just assess where we are emotionally. The other source of self-awareness is recognizing how others are responding to this. This is often challenging because we tend to see what we want to see. That's why a lot of folks will ask us, are you actively listening? Because most of the time while people are talking to us, we're having a conversation that's going on at the same time that they're trying to tell us something. And sometimes we're not attuned to how they're feeling because we're wrapped up into our own feelings. And that has a lot to do with self-awareness. So one of the tips that they have offered is to consider building time for reflection in your day. And hopefully some of you are already doing that. Some of you may call it journaling, some may just call noting. And that's consider getting into the routine of collecting specific feedback from people who will be honest and whose ideas you value. In terms of self-management is your ability to control your emotions. This component also includes your transparency, adaptability, achievement, and optimism. A key factor is whether you react or respond to situations. And that's where respond comes in. Are we responding or are we reacting? And sometimes that reacting is a reflex, could be a word that someone says, could be a flash of anger because you're feeling disrespected, or it could be our overwhelming sense of joy because you're being complimented. And the issue is, how are you responding to those emotions in that moment? Some questions to consider. When you are frustrated or annoyed, do you sometimes respond in a harsh way without thinking? I bet if we talked about how we use email, I bet most of you would probably say that's something I sometimes do. But a lot of people now do is they'll type it all out and then they'll read it again, and sometimes they'll send it and sometimes they'll delete it. That's the same thing that we're talking about when we're talking about emotional intelligence. You may want to say something, but should you at that moment? Do you sometimes find yourself regretting how you handled yourself and wishing that you had been more calm and poised? Do you lose patience or rush others? I'm finding that as I get older, I am patient, but in facilitation, sometimes my button is when I'm challenged on a particular either point or group agreement. That I find I don't have a lot of patience. And so that's something I have to continually work on. And that's why I always co-facilitate with someone, because when I know that I'm beginning to unwind, I will tap my co-facilitator and say, can you handle this? So If you responded to any of these questions by saying yes, you may be in the habit of reacting rather than responding. When you react, you do what comes naturally, which is going with the emotional part of your brain. When you respond, you act against what is natural, which is why it's difficult. You engage the rational part of your brain and try to select the appropriate response. Next slide, please. And this is social competency. We just talked about personal competency, and this really is about you in relationship with other people. I think that you probably can, these slides are, the font is a little small, but we can send you the complete slide deck with the notes if you would like those as well. So when we talk about social competency, we're talking about understanding others, empathy, and relationship management. So let's talk about relationship management. That's developing others, serving as an inspiring leader or catalyst for change. And yes, believe it or not, those of you who are running social support groups, you are an inspiring leader and catalyst for change, because people are coming because they need either to connect with others or they're trying to resolve some issues in their life and need that leader to somehow direct them. Collaborating with a high-performing team and managing conflict are part of relationship management. You are high on this characteristic if others perceive you as likable and you're able to work well with diverse groups, even in the face of stress and conflict. As you can imagine, to do this requires the three characteristics we just discussed, plus finesse in dealing with others. So we won't go through each one of these, but they're all important, as you can tell. Next slide, please. So, in a nutshell, social skills and emotional intelligence involves the following skills. Are you able to influence? Are you able to communicate? Are you able to do conflict management? Are you able to lead? Are you able to serve as a change agent? And are you able to build bonds? So influence is wielding effective tactics for persuasion. Communication, listening openly and sending convincing messages. Conflict management involves negotiating and resolving disagreements. Leadership is inspiring and guiding individuals and groups. Change catalyst is initiating or managing change, and building bonds is nurturing relationships. Next slide, please. And I'm going to now give you some tools, because what I gave you was a real brief general overview of emotional intelligence. There's a lot of great materials on the web and in the library as well, if you're interested in looking these things up on your own. But the tools I have here, I know all of you know these emojis. They are part of our everyday life now. So whether you're in a in-person or virtual support group, you can use these in person. It might be nice when people are coming in as an icebreaker to ask them how they're feeling. That way you get a nice gauge of what folks are doing. And you could also put numbers on these faces in case you have a virtual support group, and then just ask people if they're able to be on Zoom or where they can see each other face to face. Just put the number in the chat box or just describe the feeling that they're having. On the conference call, that might be a little bit more difficult, but I believe it's doable as well. I mean, a check-in is just, how are you feeling today? And folks will tell you. And you, if you're actively listening as a facilitator, you might ask someone to tell you more if there's some clarification that you need. Next slide. All of you I know have used this. Can you tell me what you're experiencing? So if in the middle of the group, someone's emotional state has changed, most times people wear their emotions right on the sleeve, and you can see what's going on with people if you're paying attention. And you might want to ask, can you tell me what's going on with you, or what are you experiencing right now? And the last slide is strategies for managing challenging situations. And I've had to use all four of these. In a training I was in recently, I was doing a presentation on trauma-informed care and asking people to take deep dives in their own looking at their own traumatic life experiences. And so it's always a good thing to have, not to leave people in the state that you put them in, but to bring them back out into a better state. And some of the ways I do this is breathing, asking people to take deep breaths. A lot of this you may know as mindfulness. So breathing is a really important component of mindfulness, just getting people to do belly breathing, deep breathing, maybe having them stand up or sit if they cannot stand up, and doing some stretching with their hands over their head, maybe lifting their ankles off of their heels off the ground, just to stretch the legs a little bit. Redirecting is a really good one, where folks may want to take a deep dive. They're engaged, they're enthralled in a story that someone is telling them, and you realize that the group may not be in a safe place to do that. So a nice way of doing that is just saying, well, what have you thought about this? To get their attention to somewhere else. Another is, if you're in a tense situation and the folks are present in front of you, is to get people to look around the room and tell you what colors do they see. Everything that you're doing here is to try to bring them back to a present state, so that they are able to manage their emotions. And then encourage laughter. I know all of you know this one. Laughter, right? My go-to now is Walter the Frenchy dog. So if you're interested in finding out why Walter is so hysterical, just go on YouTube and put in Walter the Frenchy dog. And I tell you, if in an emotionally charged situation, if you put on Walter, people will come back to the present. And that's the end of my presentation. And if you have any comments or questions, I believe you can ask a few right now, or we can wait to the end when we have the discussion.
So I think we can ask a few of those questions right now, Vanessa. Thank you so much. So if anyone has any questions for Vanessa, feel free to type them in the Q&A box. Like I said, we will have time for questions at the end as well. But since everyone's presentations are about something slightly different, we don't want anyone to kind of forget their questions. So I'll give everyone about a minute to do that.
And I don't think there's any. I think I would keep going.
Yep. All right, so I'm not seeing anything right now, but if you think of a question for Vanessa, within the next few minutes, obviously feel free to type in the Q&A, and then we will address it at the very end. So, all right, thank you so much, Vanessa.
Okay.
So now we're going to move on to our next presentation from Giovanna Carr. So Giovanna is a licensed marriage and family therapist who is a mental health counselor at Christie's Place, a nonprofit organization that provides comprehensive social services and mental health services for women, children, and families living with HIV/AIDS. So Giovanna provides trauma-informed, culturally competent individual, couples, family, and group therapy using evidence-based approaches such as cognitive behavioral therapy, DBT, and solution-focused therapy. Giovanna is certified in STARE, which is Skills, Training, and Effective and Interpersonal Regulation, narrative therapy used with women who have PTSD, and has a background working in social services for over 10 years. Giovanna is a sitting member of the Culturally Competent and Trauma-Informed team, and she has an MA in Sociology that she earned at Humboldt State University in 1999, and another MA in Psychology that she earned at Chapman in 2011. Giovanna is an experienced adjunct professor with over 18 years experience teaching courses in sociology, criminal justice, psychology, and research. So thank you so much for being on with us, Giovanna.
Thank you. I appreciate it. I'm very excited to be part of this. So today I'm going to be talking a little bit about trauma-informed facilitation. This is usually something I do in longer than 20 minutes. So I just decided I was going to put a lot of information in here on the slides, because I also assumed that we would be posting them somewhere that people could go to with the comments and everything else. So I'm just going to dive right in. And next slide, please. Just for the purposes of our conversation here, I wanted to make sure that we had a working definition of what trauma is. I think it's really important, and you'll notice that I bolded some of the letters in this definition, which we got from SAMHSA in 2013 when we started to work with trauma-informed care, and it is the individual trauma results from an event. series of events or a set of circumstances that are experienced by an individual as physically and or emotionally harmful or threatening and has lasting adverse effects on the individual's functioning and mental, physical, social, emotional, and or spiritual well-being. And I'm sure all of us can think about a lot of examples of what those potentially traumatic life experiences might be, but I just put some in the notes, so like childhood neglect, death of a parent, rape, combat and war, and in the work that I do, sometimes serious medical conditions can actually result in trauma. And so next slide, please. When we're working with trauma and women specifically, or people that are living with HIV, we work mostly with women. It's really important to know the impact that trauma has in their life. They are so disproportionately affected by trauma and violence that we recently did a study here, and literally every single participant that screened for this study had trauma in their background. And so I find it very interesting. These statistics really kind of bring it home. And 90% of public mental health clients experience multiple exposures of trauma. 75% of people in substance abuse treatment report abuse and trauma histories. And trauma can impact women's identity, sense of purpose, their relationships, expectations of self and other, and as we just spoke about, emotion regulation, their worldview, and of course, outcomes. Next slide. So here's some more about the effects of trauma, and importantly for those of us who are working with individuals living with HIV and AIDS, are the health outcomes. So I just wanted to take a moment and talk about that we have, poor health-related quality of life, higher rates of medication non-adherence, and antiretroviral failure, higher mortality rates, and higher rates of transmission and risky behavior. This model emphasizes the need for behavioral health practitioners and organizations to recognize the prevalence in the lives of people that they serve to develop trauma-sensitive and trauma-responsive services. I'm sure most of us know that, but I think it's so important to start with that. Next slide, please. So what is trauma-informed care? Right? What does it mean to be, trauma informed? And on here, I've provided you with a definition that we also got when we started this program here. Hello, lost my place, I'm sorry. Trauma informed care is a resilience-focused and strength-based approach to service provision that involves understanding, recognizing, and responding to the effects of trauma. And I think it's really important, that second part is, in order to provide effective services, we must understand that current or past trauma may be contributing to a person's current difficulties. People who have lived histories of trauma are often very sensitive people, or to people, to places, to things that remind them of the traumatic event or events. And these reminders or triggers may cause a person to relive components of the traumatic event, which may result in her experiencing in the service setting as distressing rather than as a place of healing and wellness. And so one of the things that I highly recommend when working with individuals is A, assuming that there already is trauma rather than there isn't trauma. And then B, also kind of reminding yourself they're presenting today because of their past experiences. Okay, next slide, please. And so what does trauma-informed service delivery look like? So when we're thinking about what that might look like, it occurs in a setting that is respectful, welcoming, and safe. And here at where I work at Christie's Place, one of the amazing things is that our place is actually a home. And so they do come into a home. There's a living room. There's a welcome area. The offices are specifically organized so that nobody sits behind a desk when talking to a client. We're all kind of equals. There's not a division of power or authority. It also is influenced by understanding the impact of violence and abuse on a person's life and development. Again, you know, the idea of like they're presenting today because of their previous experiences. It's based on an empowerment model. So we're always looking at ways to help women empower themselves to be able to communicate better, more effectively. We offer a safe place for them to ride that emotional, you know, surf that emotional wave. And we want to foster growth, recognize and promote resiliency, understand that behaviors that have traditionally been viewed through pathological lens are often attempts at coping that may or may not result in the outcomes that an individual desires. So again, that idea of like they're presenting in ways that have allowed them to survive up until this point. And so oftentimes they aren't maybe necessarily as effective in the setting today as they were before. And that can show up in group settings often. Okay, next slide, please. So I'm sharing with you what we took from the Office of Women's Health in 2013 to begin our program here at Christie's Place, and it's the qualities of a trauma-informed system of care. And the 4 components that we used and implemented into how we work here at Christie's Place are intentionality, and we use these as the key principles, and I find them to be very helpful, especially if you're trying to develop a trauma-informed program in your organization. And these are things that we share as humans, and when it comes to mental health and trauma, we are all peers in some way. These things will help you focus when you're trying to figure out what to implement when you're creating your own program. So intentionality, purposeful efforts towards creating and sustaining health, healing and growth. So why are we here? What's the purpose of the group? Mutuality, healing happens in relationships. Reciprocal connections, which foster increased understanding and shared learning. Commonality, we all have a story. Life experiences shape our perceptions of ourselves and others. And potentiality, positive change is possible for all individuals, organizations, and communities. And so when I keep all of this in mind, and when I'm starting a group or continuing with a group that I have going, we look at how we can implement these things into our setting. And some of the ways that we do that are like, we set up rules of the group, right? And we ask those who are participants in the group to also contribute to them, or to change the wording of the rule that is easier for them to understand or to digest. We ask them what their expectations are at the beginning of a group, and then we see if we can somehow incorporate them if they haven't already been part of the agenda for that group. We create a warm and safe environment. So one of the things that I'm lucky enough to do, because I'm doing it in person, is I make sure that we have lunch available for people, because I find if you can break bread, and it kind of bonds us together. And we have a Tuesday night group here at Christie's Place that is has been going on. It's one of the longest support groups in San Diego for people living with HIV and AIDS. And some of the things that they quoted when I was talking to them about it were the idea that it was warm and receptive, that there was a lot of psychoeducation so that knowledge was power, that there's peer run or co-facilitated by peers, and that it's a safe space. And so for me as a licensed clinician here, one of the things I always do is bring in a peer and have them co-facilitate the groups with me. Okay, next slide. I'm sharing with you the core components to keep in mind. These are the core components that we created here at Christie's Place. So your core components might look different from this, but we thought we would share these with you. It took us almost 2 years to finalize these. But as you can see, we've got like the core component 1 is agency and empowerment. And this is really important. It supports a belief of one's capability to heal and recover, and it is the biggest part of what we're doing here. It fosters the integrity, the respect, the dignity of service, recipients and providers. So it keeps in mind all of the players that are in this. The second one we came up with was meaningful inclusion of women living with HIV. And we wanted to make sure that they were part of everything, and so they felt they are part of everything. They're why we're here. And so that includes things like focus groups and surveys to inform us of our service provision. We do educational presentations with peers, by peers. And like I mentioned before, we make sure that if a group is run by somebody who is not living with HIV and AIDS, that we make sure to bring in a peer so that they are able to relate and empower each other. With the core component number 3, education and support, ongoing training for service providers and a supportive agency environment also looks like making sure that we talk about things like secondary trauma and self-care, building healthy relationships, consistent staff, healthy boundaries, staff modeling support for one another, and clients supporting one another. And really that emphasis on self-care and fostering resilience. Oftentimes we will actually see the development in our support groups of friendships and support groups between the individual clients, which is exactly what we want to see. Intentional practice, services target trauma-related related barriers that prevent effective engagement based case management, treatment adherence, support, and education. So our peers really step in at that point, and we do that in our support groups. My internet is unstable, I apologize. And we're always assessing for trauma, basic needs, and trauma-informed orientation to ensure consent. And that's really important in a group setting as well. And then last but certainly not least, the 5th component is trauma-informed environment. So we're gender responsive and culturally competent. Physical location is really important, and ambiance. And online, that's going to look really different. And I do understand that. But I wanted to share these because at Christie's Place, we felt like they were the most important and would allow us to implement an effective trauma-informed program. So I went through that really, really fast. But are there any questions?
Yes, thank you, Giovanna. So if anybody has any questions about trauma-informed care or the kind of very particular model that they use at Christie's Place, please feel free to type them in the Q&A box now or in the chat if you prefer. And so I actually had a question, Giovanna. Do you just have that one group on the Tuesday nights, or do you have multiple different groups for kind of different subsets of folks?
We have multiple different groups and for different subsets of folks. So we do like a heterosexual group. We do a support group for just women. We do all sorts of different ones. It was just I happened to talk to the Tuesday night group when I was making these slides. So that's why I just mentioned that one.
Mm-hmm. Perfect. All right, so I'm not seeing any questions right now, but again, if you can think of something later on or if you want to ask something near the end, then definitely feel free to continue to type them in the Q&A box. And to answer a question, just for some people who came on late, for somebody who asked, yes, we will be sharing a recording of the webinar with all of you, and we will also send out all these slides. I know, like Giovanna said, like Vanessa said, some of them have a lot of information, so you'll definitely be able to take a closer look at them. All right, excellent. So now we will move on to our final presenter, and this is Theresa Allen. So Theresa has more than 30 years of clinical human service and training experience. Throughout her career as a licensed clinical social worker, Theresa has maintained a private practice and held various positions, including executive director, adjunct faculty member, master trainer, organizational development consultant, clinical director, life coach, motivational speaker, and seminar/workshop designer and facilitator. Within these capacities, she is a consultant for family and children caring agencies and HIV/AIDS programs, where she provides development and training, as well as supervision and clinical oversight for staff and interns who are working with clients who are enrolled in various programs and settings. And she is currently one of the co-facilitators of the English Love Your Life National Virtual Support Group. So again, if you have any questions for her about that, feel free to ask. We really do encourage all of you to try to consider adding some sort of virtual or call-in component to your on-site groups. And sometimes people think that might be a little bit complicated, but it can be as easy as having kind of a conference call line or something that people can call into. When we did a lot of research around this project, we found that a lot of women were having trouble getting to on-site groups due to difficulties with transportation or fear of stigma. You know, if you show up to a group on site in an agency, it kind of implies that you're living with HIV, and a lot of people didn't want people in the neighborhood to know that. So having that call-in option is really fantastic. It allows more women to join your group, and I'm sure Theresa will be able to speak to the success of the virtual groups that we've had thus far. So Theresa, I'll give you the floor. And I think you might be muted right now.
Okay, let me.
There we go. Perfect.
Can you hear me now? Okay,
yep,
great.
Absolutely.
So good afternoon, everyone, and thank you, Veronica. And it is my pleasure to be on this call today to talk about my experience in facilitating the virtual group, designing the monthly agenda, trying to make it fit, and I do that with my co-facilitator, Lapina, and we've been doing this now, I guess, since, is it June or July? Around there, and it's just been phenomenal. So there are a few things that I'd like to share, and I think they would be applicable for the virtual groups as well as the in-person groups. And you could start with the slides, Veronica, please. So the first one is it says when to intervene in the group. And while it's about intervening in the group, I believe it has more to do with the facilitator. Oftentimes in the role as a facilitator, we think we're there to fix, we want to help people, we want to solve problems, and sometimes if we're not aware of what our own motivations are, it can backfire. So I usually engage myself in a 3-part conversation before I speak. First thing I say to myself, well, does this need to be said? Whatever's going on, somebody's having a bad day or a good day, somebody is talking too much and monopolizing the time, do I need to say something? The second thing, I say to myself, well, if something needs to be said, does it need to be said by me? Oftentimes, group members will pick up on what's going on and they will support or put other members in check without the facilitator having to do that. And when that happens, it actually may be more beneficial. And then the third thing I ask myself is, okay, if it needs to be said, and it needs to be said by me, is now the time. When we are facilitating groups, either virtually or in person, as it was already mentioned, timing is key. I look at the time. Well, how much time is left for the group? Do I need to say something now and the group will end, and what state will I be leaving someone in? If I need to say something now, should it be about clarifying information, about maintaining boundaries, about the norms? Am I giving information? Am I asking a question? So why do I need to say it right now? Is it really, really important? And engaging myself in that 3-part conversation, I believe has helped myself and Lapina be quite successful in engaging the members via in a virtual group. So facilitators should practice these emotional quotient or emotional intelligence skills as well. other than sharing factual information and moving the agenda along, I suggest strongly that you always ask yourself these three questions. We also know that we try to pause, and in that pause, as you're listening and trying to figure out what is someone really, really asking, you can kind of take yourself through this exercise. Next slide, please. Another thing that I do while I'm facilitating group is remembering how important it is to validate group members, especially when they're not sitting in front of you. Where you don't have the verbal cues, or you're not observing what they're looking like, what they're doing, who's in another place, spaced out, who's very engaged, who's on a phone. You don't see that. And so you really, really have to be keen in your assessment skills. And one of the things that helps me is validating group members always. So for some group participants, group can be the only positive social interaction with others, or the only safe place they have to share. Having said that, especially on virtual calls, if it's the only place that I have a positive interaction with others, it may also be the only place that I sort of, I like to call it sucking up the air, where somebody will say something and a particular group member has something to say about everything someone says, and is always in the conversation. That person clearly needs to be validated. And how we've done that is actually by having them be a de facto co-facilitator. Thank you, so-and-so, for sharing that. That's good and gives us another way to look at it. And I found that the more we do that, that person begins to fall back because they believe that they're being helpful. If there's a group member who's particularly needy or not feeling well, we definitely give group members an opportunity to share with them what they think that group member should do, and finding a way to cut that off so that it doesn't become a two-person conversation is a bit skillful, but we again validate them and thank them for their concern, and they tend to fall back. So how do we validate? We want to help them maintain the group norms as often as necessary. So whatever the group norms are, and as I believe it's been said, that you invite your group participants to come up with their own group norms if it's possible. I believe when we started, we came up with the group norms, but we also asked for feedback. And what we included, most people, all of the members who were on that call agreed to it. Very rarely do we have to go back to the group norms. Sometimes people will talk together and we'll say, and because we can see who's on the call, and at this point we recognize voices, we also ask the group members to state their name and where they're calling from. So that also helps us out. So we'll say, okay, Veronica, I hear you, and Vanessa, I hear you. So why don't you go first, Veronica? And Vanessa, you can go second. So we kind of help to help them manage their time and not talking over each other. No matter what is said, we thank them for sharing and invite others to do the same. Again, because we know who's on the call, there might be members who aren't sharing and who might be quiet, and we check in with them. Mary, I didn't hear from you. Are you okay? Are you still there? Yes, I'm listening. This is very interesting. Thank you so much, Mary. And we make sure that they know that we do care about them. So we check in with the participants who are quiet, or comment on their different styles of participation. Oftentimes we've talked about how as adults we're different in terms of being learners as well as how we communicate. And some people are more talkative than others, and we let them know that's perfectly okay. As I mentioned before, we try to discourage dialogue between participants that's not necessarily related to the group. A few times there were events coming up and other group members didn't know about them. So 2 or 3 members would talk about, well, we're going to be at the such and such conference, or did you hear about so-and-so? And we let them know that's good information. Maybe it's something that Veronica could send out to everybody, and we try to shut it down. The last thing we do is thank them for sharing. We'll say things like, thank you for sharing, good point, excellent point. Let's come back to that. If it's too far from where we're at, we're not talking about that right now, but we'll gently say, well, let's come back to that. Someone is particularly having a hard time and sounds like they're struggling, or they may even be depressed. We'll say things like, glad that you haven't given up, and it sounds like you're doing all that you need to do to get through this. If someone says something and we're not sure what they're talking about, I'll ask them, can you tell us more about it? So those are a few examples of phrases that we use to validate participants. Next slide, please. So emotional intelligence, actually, while it's a science, it also is a soft skill. I call it a soft skill. And by soft skill, I mean that you really do have to practice it. So Vanessa mentioned mindfulness earlier. And I'm going to use it again, but I'm going to add another spin to it. So helping the participants have skills to deal with their day-to-day goings on, we talk about mindfulness. And when I talk about mindfulness, I'm speaking of giving them an opportunity or inviting them to take the opportunity to think about things that have happened to them during any given day. Those are the things that usually weigh heavy on us, and we can spin ourselves in and out of orbit about something that's happened. For some participants, it can cause them to become depressed, cause them to sort of become more reclusive. Some of them, it can cause them to be happy. So depending on what it is, we invite them to think about their reactions on a daily basis. Not about everything that happened during the day, but whatever happened to them that's weighing particularly heavy on them in a good or a bad way, or a negative way, that they should think about that. How do they feel about it? During that time, what strengths were they able to use? What were the triggers that made them see that situation in a positive or a negative light? And if the opportunity comes again, how might they handle it differently? And I think the how they would handle it differently is particularly helpful, because whatever happened is a moment in time, and it probably will happen again. And maybe they handled it in a particular way because they weren't ready or they hadn't thought about it. Giving themselves an opportunity to rehearse kind of galvanizes their responses for the next time. The second thing that you might encourage participants to do is to reframe the situation. Okay, so it wasn't a good time. It wasn't a positive thing that happened, but it doesn't mean it's a wash. So out of whatever happened, what's the takeaways? Did you learn anything? From the standpoint of whatever happened for you, how could you help? So how could it be helpful to you in another situation? So we ask them to reframe whatever happened, and not let that be the period at the end of the sentence. Number 3 is awareness. Oftentimes when, we talk about relationship and that we want them to be in relationship, but sometimes that's very difficult, especially when you're isolated and you live in remote areas. And so not knowing what emotional triggers are and what things make them feel good about themselves, or feel good about situations, or not feel good about situations, can handicap them. So this awareness of what makes me feel good, what makes me not feel good, what kinds of persons do I need to avoid, what kinds of persons or situations do I need to engage in, and asking them to do an awareness inventory about themselves so that they can help themselves out of situations and be more social. And the last point in terms of the soft skills is recognizing and celebrating positive emotions. Do-overs, sometimes we get an opportunity, sometimes we don't. But whatever happens, you can encourage them to intentionally think about and doing things that allow themselves to feel good about themselves. So here they're more in control. They get to choose. Okay, so what I like to do that make me feel good about myself is I like to take a warm bath. And I can take it as long as I want, and I can put whatever scents in the bath water that I want, and that can help change and bring about a positive emotion. I'm going to meet a good friend for lunch. I'm going to go to a group. I'm going to go to a movie. I'm going to look at my favorite TV show. I'm going to engage in an act of kindness with someone that can, make them feel good. They're not having a particularly good day, but doing something good for someone else can change that. And certainly asking them to maintain an inventory, a gratitude inventory. What kinds of things are you grateful for every single day, even when your day is not going well for you? So those are some of the things that I think you can definitely utilize in your group facilitation, be mindful of for yourselves as well as for group members. Being the facilitator and topic designer for the virtual group now, I'm more than willing to answer questions about the how-tos, the what-ifs, etc. Thank you.
All right, thank you so much, Theresa, for that presentation. So if anybody has any questions for Theresa about any of the things she just discussed or any of the kind of ins and outs of managing the virtual group in particular, I'll give you a few seconds to type those in the Q&A. And then, Theresa, did you want to talk a little bit about how you select topics for groups? Because I know in the past we've had some people discussing that it's difficult for them and you don't want to kind of be too repetitive and things like that.
Right. So we certainly do rely on what some of the things are that people bring up that we may not be able to talk about. And we try to weave those into the next topic. We have utilized the calendar to help us, holidays. The last one we did was held actually on Valentine's Day. And instead of us talking about, who didn't get candy, who didn't get roses and blah, blah, we kind of renamed Valentine's Day Love Yourself Day. And we talked about different things that they can do to love themselves. And it was a particularly good group, a lot of participation. People talked about, well, I hadn't thought about it that way. And they were able to talk about things that they could do to actually love themselves. Holidays, Christmas, Thanksgiving, Thanksgiving, we talked about family members coming and who are they going to be with? And if they weren't with anybody, how would they spend their days? So always in a way to validate, uplift, and let people know that while relationship is important, it's a reality that for many of the participants, they're all who they have. This month, Women's History Month, and piggybacking off of Black History Month, we will probably incorporate those kinds of topics as well.
Yeah, that sounds great, Theresa. And you know, just from speaking from someone who's been on the calls, it seems like the women are responding really positively to all the topics. And just something else that I can share, you know, before we started developing these virtual groups, we did a community needs assessment where we talked to over 200 women from across the country with the help from a lot of our partner organizations about what they would want to get out of support groups. And obviously, you know, our particular project is focused on women, but this can be applicable to, you know, anyone living with HIV. But a lot of the feedback we got was that people don't only want to talk about their diagnosis. You know, a lot of times they go into these groups and they talk about their viral load and the medications they're taking and things like that. And they'd rather be talking about topics that are related, but, you know, not directly. So kind of not so biomedical, I guess you'd say. So the women wanted to talk about families and their children and sex and relationships and disclosure and things like that. And obviously, ultimately, it all kind of comes back to HIV because that kind of informs a lot of the issues that the women are having in their lives. But I think we'd have a lot less success and we'd have a lot fewer people coming back to the group if that was something we were kind of harping on every single month.
Also, Vanessa, sorry, Veronica, the V's are killing me today. I'd like to say that we also open and close our groups with a quote. And the quote usually sets the tone for the group. So the quote is about whatever the topic for the group, for that group is. And we'll read the quote in the beginning and sort of lets people begin to marinate on what we're talking about. And by the time we get to the end of the group and we reread the quote, it's amazing how people have absorbed it. And I think many do write it down because they'll ask us to read it so that they can get it correctly written down. And by the end of the group, to see how they have integrated the quote in a way that they will make it applicable to their lives it's very interesting.
Yeah, absolutely. I definitely agree with you, Theresa. The quote seems to be very popular. Like you said, a lot of the women on the call tend to ask you to read it slowly so they can write it. And obviously, this isn't necessarily the topic of today's presentation, but adding any sort of like artistic or poetic elements to your support group, I know has been very effective for a lot of the people who do groups here at Iris House. Adding some sort of art therapy or having the participants write poems or doing an activity outside in nature or something like that is a good way to switch things up because I know a lot of facilitators, when I'm talking to them, they say, you know, we've been running this group for however many years, and we want to make sure that we're still keeping it fresh for people. And I know, Giovanna, you said that group at Christie's House has been running for a very long time. Do you have any other suggestions for how to kind of keep things fresh in groups?
Actually, I'm kind of piggybacking on what you guys just said is, you know, part of the reason why we do keep it fresh is to ask the clients what they're looking for, but we also pick topics that aren't necessarily biomedical and HIV related in that way. We do choose a lot of sex conversations, how to disclose. For Valentine's Day, that's actually what we did is we got on a webinar about disclosure. I personally, in the groups that I run, do add a lot of art into the group that allows the women to express in different ways. And I love that you mentioned the quotes. I put quotes up all over the place. I have boards everywhere. And I use them a lot in group too to help them reframe and relook at things. And sometimes we'll even take the group outside because we're lucky enough to live in San Diego and we're like 3 walks from Balboa Park. So sometimes we'll go outside and actually energize and heal with the outside and in nature. So we do everything you guys were talking about.
Great.
That sounds great, Giovanna. All right, so I don't see any other questions coming through so far. So again, if you can think of anything, we will finish up with the Q&A in just a few minutes. But we wanted to kind of run through a little bit of a scenario with everyone, and this is an interactive activity. So what I'm going to do is I'm going to read the story of Deborah, who is a participant in a support group. She's not a real person, but I think that a lot of you may relate and have had someone who has similar feelings and challenges in your groups. So I'm going to read her scenario to you, and then we are all going to kind of talk about what we would do in this situation as a group facilitator. So this is the opportunity for all of you who are participating on the computer to type your answers in the chat, and then the panelists will also be able to give their feedback as well, and we'll be able to come up with a solution. So Deborah is a 40-year-old cisgender woman of African descent who was diagnosed with HIV 6 months ago. Upon diagnosis, Deborah was immediately brought to a local HIV clinic. So Deborah was extremely stressed and fearful at the clinic, and during her intake, she informed the case manager that she is in a long-term relationship with a man who is the father of her 2 children. She's now considering starting HIV care and treatment, but only if she can get over her fear about her partner and other family members finding out she is HIV positive. The patient navigator recommends that she attend a local support group to kind of deal with some of these issues. So Deborah now regularly attends the support group, but at every session she tearfully talks about her living circumstances and is unable to be emotionally present for the other women. The group has been very supportive, but now indicate to you, the group facilitator, that they are starting to become frustrated with Deborah and are considering not attending the group. As a matter of fact, the popular member does not attend the next session, and she contacts you and informs you that she is not coming back to the group until something is done about Deborah. So what do you do in this situation? There's a lot of kind of things and different people and emotions to manage. So I'd love if participants would be able to type in that chat box. Again, if you're joining us a little bit late, if you kind of move your mouse down to the bottom of your screen, you'll see a button that says chat, and you can type to all panelists and attendees. So I'll give everyone a few moments to do that, and then we can talk about some of the responses, and facilitators, you can, or panelists rather, you can obviously chime in as well. So Theresa, while people are typing, do you think you'd want to give maybe kind of a little bit of feedback on the situation, or share if you've had something?
I certainly would. While I know group is, very important, and it is something that we want a lot of people to be members of because of the fact that it can work in terms of helping people heal and be part of a community and whatnot. I don't think that group is always the answer. And that as a facilitator, that there probably needs to be a screening or some sort of assessment to determine group readiness. Because as it says, it worked in the opposite. It was counterproductive. You were losing group members who were engaged in the group by adding a member. And so this particular young lady, Deborah, already came to you with being ambivalent at best in terms of her disclosure to her family. And that weighed very heavily on her. And she probably could have benefited from some individual help before joining that group. And I'll just leave it there, and I'll come back to that after.
Yeah, absolutely, Theresa. I think that's great. And we have one of our attendees, Tara, kind of echoing that, potentially refer for individual counseling, because like you said, the group setting is not necessarily always the best setting. Giovanna, do you have any commentary on this? Maybe you've had some similar situations in your time as a facilitator?
So because I'm doing them face-to-face and not on a virtual, I actually have this happen oftentimes. We do have a screening process that we put we have people go through to see whether they are ready for group. I usually have make sure that they're either in individual counseling or that they've had individual counseling, that they kind of understand that group isn't about having an individual session with 20 people who can help them solve their problems. And when it has happened, I usually just check in, not only with the person who is kind of usurping the group afterwards, and gently have a conversation with them about whether or not group is appropriate for what they're discussing and how much time they're taking. But I also check in with each of the group members and just see how they're doing. And I do that on a regular basis, so it never feels like, oh, I'm picking on one person in that group. But this does happen, and sometimes, like Theresa said, and how Tara said, individual counseling is just the best, course is to refer them to that.
I think,
Absolutely.
this is Vanessa, I think that while we're in session, because I'm assuming this is a case study where this is happening in real time. So probably I would use some of the skills that both the presenters talked about and ask the group to pause, probably take a couple deep breaths, and then ask the question so that Deborah can hear also, because maybe she forgot where she is and why she's here, to ask the participants in the group just to talk about the importance of the group to them and why they come.
Yeah, I think that's a really great idea, Vanessa, as well, to kind of frame the situation, and that will sort of potentially help Deborah identify that maybe this isn't the setting she's currently at the emotional state to be in right now, and that potentially could have some sort of referral to individual counseling like the other panelists and like Tara is saying in the chat.
I'm also thinking that if she has the wherewithal, she might be able to hear enough where she realizes, I'm not the only person here. It's a growth moment for her. It may be that she needs to be in individual counseling, but while we're there together in that moment, I would want to try to help her out that way, as well as the other members in the group who are getting ready to revolt and go out the door. So just to try to bring them all back together and have them kind of work it out, facilitate their working it out as a group. But at the end of the day, I think all three of you are correct, and that she probably needs a little bit more time before she comes into a group. But sometimes people don't know that until they're in a group, even if they've been assessed.
True, absolutely. And I think one of the things that I incorporated into the groups that I run is I do a quick check-in at the beginning of group. And so it gives each person a chance to check in. And in that check-in, they are able to say that they would like some time at the end of group or in the middle of group or whenever we give it. And then they know that they have about 3 to 5 minutes to talk about something that's specific.
That's great.
And that's going on in their life right then and there. And that gives the group the opportunity to say, I have that too, or normalize it or give some feedback, but we keep it to a really designated amount of time. And it takes a little bit of, training, but they all catch on really fast. And that helps to alleviate some of this issue.
To the degree that we have the wherewithal to do it, sometimes I also think of groups and putting group members together like having a party. And there are certain people that you don't particularly want in the same room. Like we're all friends, but I wouldn't necessarily invite you to this party, but I'll invite you to another party. And just because there's a group, it doesn't mean that everybody should be in that particular group. People will self-select out. You can't manage all of that all the time. But if somebody's leaving the group because someone is I wouldn't say destructive, but they're not getting anything, we want to be mindful of that. Group is work. It's not, like you decide you want to have steak instead of chicken. The group members are all there for the, similar purposes. But particular people with particular needs may not be a good fit for a group, even though that's the group that's available. So I think it's the responsibility of the facilitator to know that and figure that out, and not necessarily the group member.
Absolutely. I agree.
Yeah, definitely. And something else that Sonia brought up in the chat as well is to potentially also talk to the group about the way they're reacting to Deborah. And I've used this kind of scenario in different trainings before, and I've had people say, sometimes if you have a lot of long-term survivors in a group, people don't necessarily forget what it's like to be newly positive, but that emotion, they've been living with the virus for so long, and it's kind of something that they've become accustomed to and really integrated into their life. And it's sometimes hard to kind of get back into that emotional place of when you were first diagnosed, because you don't want to, because it's a very traumatic time. So I think that's a good idea with Sonia as well. If you feel like it's kind of an issue with the other group members being a little bit cold or callous in certain situations, kind of bringing it back to them and saying, try to put yourself back in Deborah's shoes. Try to remember when you were in her situation and how kind of vulnerable you were.
I like that idea.
All right. Does anybody else have any other feedback for this scenario? All right, so I'm not seeing anything else in the chat or anything else in the Q&A. But one other thing I wanted to ask you, since we do have 10 minutes before time, is just any of the panelists to kind of chime in, because this is a question we've gotten before when we're doing capacity building around this, is to kind of talk a little bit about how you might deal with two members of a group who are kind of arguing, or maybe they have different world views, and it kind of tends to get a little bit heated between them sometimes, and how you would manage that.
I would probably go back to the norms, that we could agree to disagree and be respectful about it. It getting heated, does that have to do with what we're talking about? Certainly using the group as an opportunity to let people see that you don't have to agree with somebody, and they're not necessarily wrong because you don't agree with them or they don't agree with you, that people can hold various viewpoints, and it doesn't mean that you have to argue about it or fight about it. So using it as a teachable moment for not only about the group, but I would maybe even try to flip the whatever it is they're arguing about and bring it back to, well, what happens when you're home, or what happens when you're with a partner and they don't agree? How do you respond to them if they're not in agreement with what you say? So try to make it be more practical in terms of how they handle themselves, as opposed to getting caught up in whatever it is they're arguing about.
I agree. Sorry, Veronica, did you want to add something?
Oh, no, I was going to thank Theresa and see if you had any commentary, so feel free to go ahead.
So I absolutely agree. This actually happens, often. And when it does happen, I too kind of refer back to the expectations of the group and the expectations of the group behavior and the idea of agreeing to disagree. I call them chocolate chip cookie moments. And I will bring up right then and there, oh, that sounds like a chocolate chip cookie moment. In other words, it's a time where, one person, remembering that one person might make chocolate chip cookies with butter and one person might make them with a butter substitute, but they're both equally as yummy and good. And there's no one way to make a chocolate chip cookie. And I like the chocolate chip cookie moment because it kind of lightens the mood immediately, and it recenters and focuses the members on, oh, wait a minute, that's right. We have different perspectives. We can both have lived at the same experience and walked away with two different views. And oftentimes I'll try to slip in a tool. We do a lot of assertive communication techniques in group. So I'll try and slip in a tool like mirroring and saying, so I feel like, or I'm hearing you say, and then I'll say, so what did you hear? And try and get other members of the group or the two people that are disagreeing to sort of see it from each other's perspective, and model for them a way of communicating. And yes, also bringing it back to, is this what happens at home? Is this how they communicate with difficulties in other scenarios?
Giovanna, it's also, I would also go back to something you were talking about earlier in terms of trauma-informed care, letting people know that given life's experiences and, you know, the vicissitudes of life and ups and downs, somebody may hear something or experience something very different than someone who's never had that experience. So we also have to allow for that if your house never burned down, and you're saying, well, why can't you just go to Red Cross and go to a hotel? That's true, but you also don't have the life experience of losing all of your belongings. So that person may see it very differently and may have an emotional response that the other person may not have. So bringing that back into the mix of, depending on what path and what road people have walked, they may see it differently. So letting them know that in a kind of coded way that empathy is important.
Absolutely.
All right, thank you so much for your suggestions. So as long as nobody else has anything else going on in the chat or in the Q&A, I think we are going to start closing. So we already did our questions and answers. So I'd like to take a moment to thank all of our lovely panelists, as well as our partner organizations that have helped us create this project, in particular ViV Healthcare, which is the main sponsor of the Love Your Life project and of these webinars. So we wanted to let everyone on the webinar know that we really value your feedback. And after exiting this webinar, you should receive some sort of survey monkey that will ask you about the quality of today's webinar, what could be improved. So feel free to be as honest as possible, because we really love that feedback and we want to continue improving these webinars. As I said before, we have recorded this, and so we should be able to send you all the recording in case you want to share it to any of your colleagues who you think might benefit from today's discussion. And we are also going to be sending out the slides as well. So as part of this Love Your Life project, Iris House is going to continue hosting these capacity building webinars in the coming months. And so now that you've all registered for this one, if we have one in the future, we'll shoot the promotional material to you via email in case you'd like to participate again. And as I said earlier, if you have any questions, you could feel free to get in touch with me, Veronica Karp. So my email is up on the screen right now. And if you have any questions of the other panelists or facilitators, I can obviously pass that on to them as well. So thank you so much, everyone, for participating today, and have a good rest of your afternoon.
Great. Thank you.
Thank you.
Yes, thank you.
So what do we do here?
Yeah, the house is too long. I was looking for her.